Hi guys, welcome back to my Mommy's Life channel where I share with you guys my journey as a first-time mom, dentist, and business owner. And as always, I love to hear from you guys, so please make sure to leave me a comment below if you guys have a topic that you guys want me to cover in one of my videos. And in today's video, it's going to be perfect timing because Caitlin is definitely walking, but she's not super great at it. She's stumbling and she falls on her face all the time. So what does a dentist do when she sees this? The first thing that comes to my mind is, oh my gosh, is her tooth okay? Because she does have 8 going on 9 teeth. So she's got a lot of teeth. And you know, the first thing you see when she goes flat on her face is like, oh no, that's gonna be bad. So I thought this would be a perfect opportunity to share with you guys a problem that I see all the time, day to day at work. And this is, you know, parents calling me distraught, you know, not sure what to do when his or her child or teenager has injured a tooth, you know, whether it be falling, whether it be riding a bike or during sports practice. It does happen occasionally. So, you know, I wanted to share with you guys, you know, the things that you should do, look out for, and hopefully this will make you guys a little bit more confident if the unfortunate event happens to you guys. Now, this is a very big topic. So this is going to be a 2-part series. In today's, we're going to cover strictly what to do with primary teeth. In my next video, in part 2, we'll talk about permanent teeth. And make sure you tune into that video because there's a lot of things that is very time sensitive, you know, things that you should and shouldn't do during the incident, you know, well before you even get to the dentist's office. So make sure you tune into that, and if you haven't done so already, make sure you hit subscribe so that you see when I post that video, okay? So let's get going with today's video. So if you have a little one who still has baby teeth, and say they fall on the, you know, hit their chin on the coffee table, or they fall on their face, and they injure the tooth, what do? So the first thing, of course, is give your dentist a call. They'll try to get you in as soon as possible. For me, we always try to prioritize those visits because we know that it's very time sensitive. And so, you know, we get you in, we take a look at your child. One of the big things that you'll see throughout, you know, any type of injury, and there's many types, with the little ones, it's really supportive care. You know, we want to take care of any external injuries, bruises, lacerations, that type of thing. We want to make sure we take care of that, and that's kind of the primary focus. In terms of the teeth, if they, you know, chipped it, really minor, we may not treat it right away. Depending on the age of the child, we may wait till they're a little bit older, and then we may go back and restore the tooth for aesthetic purposes. If they, for example, hit their chin, the tooth gets pushed up into the jaw, what do you do in those instances? I think those are the types where parents get really, really afraid. They're like, oh no, the tooth is not in the right spot. You know, that tooth was perfect before. And the good news is with this type of injury, we usually just monitor the tooth over the course of a couple weeks. And most of the time, the tooth will kind of drift back into place spontaneously. So, you know, most of the time, those cases are pretty straightforward. The tooth will kind of go back and everything will be okay. The other kind that I see very often is, you know, they may completely knock out the tooth altogether. And these ones are a little bit sad because we kind of have to tell the parents, you know, we typically don't replant these teeth. And it's better for, you know, the child. We don't want to cause any damage or anything to the developing permanent follicle that's still inside. So in those situations, we just gotta tell the parents, hey, the tooth fairy is gonna be coming a little early for this one. And then we focus on the supportive care. So those are 3 of the biggest types of injuries. Of course, there's a lot of variation, everything in between that spectrum that can happen. So since I was talking about supportive care, let's take a moment to go back and really go into what does it mean when we say supportive care for the child. So when it comes to primary teeth, you know, we want to really make sure that we take care of any external injuries. So, you know, if there's any bruising, lacerations, making sure we give the patient soft food so we don't further damage the teeth. You know, give them a little Tylenol if they're complaining of a lot of pain, as well as maybe icing the area to kind of help with any swelling and bruising, that type of thing. So those are kind of the main things, and just really, you know, be supportive. And after about a week or two, you know, things should really resolve on their own. Before I end this video though, I want to go over some really big things. It's more about the aftermath of the injury and not so focused on, you know, the injury itself. So one of the biggest things that I warn parents is, you know, depending on how hard they bump their tooth, you may actually see some defects in the permanent tooth. Okay, and that really just depends on what time the injury was in terms of the developmental stage of the permanent tooth. So, you know, the tooth may come in with a little white lesion or something like that on the tooth, indicating that, you know, it might have been traumatized when it was developing. Not to worry though, usually we can correct these things cosmetically with some dental treatment pretty conservatively. So, you know, if that does happen, don't be alarmed, you know, we'll take care of it at that time. The other thing is making sure that we look out for any signs of concussion. I think not often enough we don't focus on, you know, those types of things. You know, we're so focused on like the physical signs of injury at the time, you know, like a bloody lip and that type of thing. We kind of forget, like, how did the fall happen? Was there any chance that, you know, he or she may have hit their head? Because, you know, concussions can be life-threatening. And so with my parents, I always go over, you know, things to look out for, you know, whether it be nausea, vomiting, over sleepiness, any behavioral changes. You know, those are just some of the signs of a possible concussion. So I really recommend, if you guys haven't talked to your pediatrician about this, open that subject up. Let them go over with you things to look out for, what to do, you know, if you suspect that your child might have a concussion, because that is really, really serious. So make sure that you talk to your MD about it, because obviously those few signs that I brought up just now isn't the only things to look out for. But I do always remind my parents that, hey, this is, you know, really important. It may show up later, so, you know, keep a really close eye on it. Okay, and that's pretty much it. So, you know, I just want you guys to feel a little bit more comfortable. You know, it's okay. Things will be just fine. Just make sure you give us a call as soon as you can. We'll try to get you in as quickly as possible, and we'll kind of go over all these things with you as well, because injuries will happen, especially if you have a child like Caitlin who just cannot sit still whatsoever. So, you know, hope you guys feel better about this. Make sure you stick around for the next video, which will come out in a couple weeks. That's going to be a really, really important subject, because we're actually talking about putting teeth back in that may have completely been knocked out, because in the permanent teeth, we do want to try to save it. So make sure you tune in. A lot of good stuff in that video, okay? See you guys next time. Bye.